Welcome to our channel. Today this video is a video about hepatitis, and since it is the World Hepatitis Day today, it is a pledge to end hepatitis in this world, and this is an awareness video about hepatitis. Okay. Today, that is 28th July, is observed as the World Hepatitis Day. So why 28th July? Because it is the birthday of Dr. Baruch Blumberg. And who is he? He is a national award winner, and he actually found out hepatitis virus, and he designed the diagnosis test for it and also found the vaccine against this virus. What is hepatitis? It is an inflammation of the liver. Okay. So what is inflammation? What is inflammation? Inflammation is nothing but an injury to the liver. So just imagine your skin. What happens to your skin when it is injured? There is redness at the site of infection, and then you have pain, you have swelling. All these conditions together we call it as inflammation. Okay. Sometimes hepatitis is fatal, and the various types of viruses which cause hepatitis is hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E. We call them HAV, HBV, HCV, HDV and HEV. Now we will see about HAV transmission, that is the transmission of hepatitis A virus. Okay, this happens by the consumption of contaminated food and water. Contaminated food and water, so it is prevalently present in contaminated food and water. It also happens with the direct contact with an infected person. Direct contact with an infected person doesn't mean living with them, sharing food with them, using their bed sheets, using their pillows. All those things, they don't transfer this disease, but sharing the drug needles, sharing the razors, sharing your toothbrush with an infected person will lead to the transfer of the disease. And 100% of the patients who are infected with HAV transmission, they recover completely along with lifetime immunity. It also gives us lifetime immunity. It can be very well prevented with a vaccine, and this virus, it occurs in the blood and stool of the infected person. Symptoms, it is more and more all similar for all the types of viruses, that is A, B, C, D, E. The symptoms of hepatitis is almost one and the same. Now for A, we will see it is fatigue, nausea, vomiting, abdominal pain, jaundice, dark urine and pale stool. Okay, fatigue, itching will also be there. Fatigue and itching is a very common symptom for hepatitis, and you may ask, it is also a very similar symptom for most of the other diseases. How can you differentiate it? See, fatigue and itching, if it lasts for more than 7 days, more than 10 days for a patient, then you should reach your medical practitioner, doctor, and you should ask for some treatment where they will go for some diagnosis and they will identify it. Actually, if it keeps on persisting, then it is a communication of your body. So itching, fatigue, all these things should not be taken as it is very easy, it is not a serious issue. It is not like that. If it persists, you should go to your medical officer and take proper treatment. Okay. Then coming to vomiting, abdominal pain, jaundice. See, in India or in the countries, there are practices where jaundice comes, and jaundice is treated with herbal medicines, some other medicines also. There are home remedies even for jaundice, but you should understand the root cause of jaundice. Why did jaundice occur to you? What was the reason behind it? If hepatitis is the reason, then proper treatment for hepatitis should be taken. Hepatitis symptom of jaundice could be the root cause of hepatitis also. So proper diagnosis, proper tests, lab tests can only prove that hepatitis was the reason. So jaundice should not be taken very easy, and even if it is properly treated at home, you should go for a test to just check whether it was because of hepatitis. Okay. Now, under the children of 6 years age, hepatitis infection, it is mostly asymptomatic, and patients, they usually recover within 1 or 2 weeks of the infection, and rarely hepatitis A becomes chronic. Mostly it is acute and rarely it becomes chronic. Now, coming to post exposure prophylaxis, for hepatitis A, the vaccine is there from age 1 to 40 years, and actually nowadays, the child, whenever it is born, on the first day of its birth, doctors, they give them the hepatitis vaccine, and there are 3 doses of hepatitis vaccine, so we should be careful to take all the 3 doses. Now, apart from this, uh, um, above this age, hepatitis A virus specific immunoglobulin, that is Ig, is available. Okay, and however, maybe in some cases immunoglobulin is not available, and in that case hepatitis A vaccine can be very well substituted for immunoglobulin. And those with the evidence of previous vaccination or who can confirm previous hepatitis A illness, they do not require post exposure prophylaxis. Now, coming to hepatitis B virus. Okay, this is a life threatening liver infection. It causes both acute as well as chronic disease. Coming to the transmission of the disease, it gets transmitted by vertical as well as horizontal transmission. So, vertical transmission is nothing but transfer of the infection from mother to the child, which can happen either during the pregnancy, during the delivery time, and how can it happen during delivery time? By the exposure of the baby to the amniotic fluid, the blood of the mother, I mean the infected blood of infected mother, etc. This is also referred to as perinatal transmission. So, vertical transmission is also referred to as perinatal transmission, and the second thing is horizontal transmission, that is infection which transfers from an infected baby to an uninfected child or baby, and this can happen from 1 to 5 or 6 years of age, most common age for transfer of this infection. This hepatitis B virus, it occurs by the contact with blood or other body fluids, fluids, which includes the seminal fluids, the vaginal fluids, then saliva, everything, body fluids during sex with an infected partner, infected needles, infected syringes, infected medical equipments, etc. Incubation and infection of hepatitis B virus. This hepatitis B virus, it can survive outside the body for at least 7 days, and however, even during this period, if the particular person is not vaccinated, then it can be infectious. The incubation period for hepatitis B virus, it ranges from 30 to 180 days, and this virus, it can be detected from 30 to 60 days after infection. Okay. Symptoms: the initial period of infection, the initial period is completely asymptomatic. There will be no symptoms at all. But however, some people, they have acute illness with symptoms that lasts for several weeks, including yellowing of the skin, yellowing of the eyes, and you know very well that this is a symptom of jaundice, dark colored urine, extreme fatigue, nausea, vomiting, abdominal pain, etc. People with acute hepatitis can develop acute liver failure, which can lead to death. Advanced liver diseases such as cirrhosis and hepatocellular carcinoma, which cause high morbidity and mortality. Okay, so cirrhosis, what is cirrhosis? It is nothing but a scarred liver, an injured liver. You can even take it in that sense. We will see the image of it in the coming slides. And then carcinoma is nothing but your cancer cells, so liver cancer. And in severe stages of these infection, I mean, I'll show you the image when of the liver infection. Some symptoms like swelling of the abdomen, matlab you can have body fluids filled in the abdomen. All these things will also occur, and it is also a predominant symptom in this case. Coming to co-infections, more than 7% of people with tuberculosis, they also have hepatitis infection, and then 2.7 million people with HIV infection, they also have hepatitis infection. These people, they become infected with both hepatitis and B at the same time. I mean hepatitis B virus and hepatitis D virus, they infect the same person at the same time. This is referred to as co-infection. And similarly, there is super infection also, means hepatitis B infection will be there for the person, and then hepatitis D virus also joins and it infects the person. So this is called super infection. Coming to hepatitis C virus, this virus can cause both acute and chronic hepatitis. It is a blood-borne virus, and antiviral medicines can cure more than 95% of the infected patients. But what happens is access to diagnosis, awareness, and treatment is very less. There is currently no effective vaccine against hepatitis C. And testing for hepatitis C, there are two tests. It is testing for anti-HCV antibodies, and once it is positive, the second test is a nucleic acid test for HCV ribonucleic acid, testing of RNA of the virus. HDV, hepatitis D virus. So as we saw earlier, hepatitis D virus, it cannot come alone, it comes along with hepatitis D virus. So it can be either a co-infection or a super infection, right? So when it is super infection, it is the severe form of chronic viral hepatitis, where we have to be very careful. Early diagnosis, early treatment can help you a lot. And then hepatitis D infection, it can be prevented by hepatitis B vaccine or immunization itself. Then treatment success rates are really low. Interferon alpha treatment is being practiced, and it is a treatment course is for 48 weeks. Diagnosis, it is diagnosed with HDV infection, is being diagnosed by high levels of anti-HDV immunoglobulin G and immunoglobulin M in the blood, and confirmed further by the detection of HDV RNA in the serum. Now hepatitis E virus, this virus is transmitted via the fecal oral route, principally via contaminated water. Detection of specific anti-HCV immunoglobulin IgM antibodies to the virus in the person's blood, you can detect it like that. And then additional test includes the RT-PCR, reverse transcriptase polymerase chain reaction, to detect hepatitis E virus RNA in blood and stool of the infected person. And you should avoid or minimize the medication things like acetaminophen, paracetamol, and medication against vomiting should be sparingly or completely avoided. Yes, see, this is the stages of the disease, and here you can have a look at the healthy liver. So this is a healthy liver, which is very normal, right? Now see, this is acute hepatitis, and this is up to the 6 months of infection. After 6 months of infection, acute hepatitis, slight difference, slight darkening of the liver. And see, this is what happened. Yeah, see here, up to from 10 to 20 years, the symptoms of this period, you will have no symptoms at all. Most probably, most of the cases, there will be no symptoms at all. Okay, no symptom stage, that is asymptomatic stage. And after 20 to 30 years, I mean this period, this is the cirrhosis liver. First it is acute, then it is becoming chronic, acute to chronic stage, and after that it becomes a cirrhosis liver. That is, your liver will be scarred, it is an injured liver, it is getting damaged, and at this stage all types of symptoms will come. You will have, people will have a swelling of the abdomen, they will have severe pain in the abdomen. Only at this time most of the patients, they reach the doctor. Okay, and as I informed you earlier, nausea, vomiting, and even itching is a very good symptom, very normal symptom, which can communicate to you that something is wrong within your body. When people reach doctors at that stage, it is very easy to eliminate the virus, it is very easy to treat the virus also. But when people come at this stage, it is difficult. And the final stage is liver cancer, carcinoma, and at this stage we will have to go for complete removal of the liver and transplantation. Okay, now coming to liver damage, why does liver damage occur? It most common thing is because of alcohol consumption, then it could be genetic, and it could be because of the diet and lifestyle. Coming to diet and lifestyle, most common thing which happens now is fatty liver. Fatty liver is because of the diet and lifestyle which people follow nowadays. So how can fatty liver be cured, and how can it be minimized? So for the cure of fatty liver, doctors prescribe a very simple thing: minimum carbohydrates. The diet for them is minimum carb, medium fat, and maximum protein. Okay, so minimum carb, medium fat, and maximum protein diet is prescribed for fatty liver patients. And of course I would recommend that this is the one balanced diet is very important and mandatory for every person. Even a normal person, if you follow balanced diet, it is very helpful. It will give you lifetime immunity, it will increase your lifespan. There are so many benefits of it. And then apart from this, they also recommend the patients to go for 45 minutes of any physical activity, which could be walking, jogging, cycling, swimming, whatever it is, but minimum 45 minutes of physical activity should be there. So diet and lifestyle also plays a very important role here. Then autoimmune responses. Autoimmune responses are things when your own immunity cells, they turn against your liver. Whenever hepatitis infection is confirmed, there are further sequence of blood tests which have to be taken, and then they will confirm the amount of virus or the severity of the disease in the patient. So there are cases when your own immune system can take care of the virus and it can help in healing, it can help you to recover. So there is no need of any treatment in that case. But there are cases where our immunity cells are helpless. In that case, we will have to go for proper treatment and the antiviral drugs will be prescribed. Okay, liver transplantation. Coming to liver transplantation, as we saw, when the entire liver is being damaged, when liver cancer occurs, then the entire liver has to be replaced and we go for liver transplantation. So there are sequence of tests which has to be tested for the matching of the liver, and then matching liver can be transplanted, and people, they lead a very normal life after that. And however, they will have to come for periodic checkups with the doctor, which starts with the once in a month, then twice in a month, then once in a month checkup, and then once in 2 months, once in 3 months, and then after that once in 6 months. Okay, what is split liver transplantation? You may have a doubt, maybe, can the liver from a brain dead person be transferred to someone? Yes, of course it can be transferred, and in the case it is a healthy liver, so it be transferred to many people. So depending on the age of the patients who receive it, age and the weight of the patients who receive it, it can be transferred to 3 or 4 people, 2 kids, 2 adults. It could be 3 would be better. So 2 adults and 2 kids and 1 adult can very well share it. And split liver, this is called split liver transplantation. Okay, we all know that liver has the capacity to regrow. So what about the infected liver and normal liver? The normal liver, if you cut 500 grams of the liver, then in 3 months it will completely grow. I mean, when after 3 months the 500 gram of the liver would be replaced, and it is very normal. But in the case of infected liver, cirrhosis liver, scarred liver, there is no chance of growing. It doesn't regrow. So if you cut 1 gram of the liver, and if you check after 3 months, there is no improvement in the liver growth. Okay. And again, coming to this, you may also have a question: can liver be grown in the laboratory? So liver is not a it is the second largest organ in our human body, and it weighs about 1.5 kgs. Okay, so it is made up of blood cells, it is made up of bile vessels, everything is there. It is not a single tissue organ, so it is very difficult to regenerate or grow the liver in the lab, and still research is going, but no one is yet successful. What is acute liver failure? So you might have heard of sudden heart attack, right? It is a case where the person is very normal before the day of the attack, and he suddenly becomes abnormal, and there is an attack on the next day. Similarly, there are also cases like acute liver failure, where your liver and yourself will be functioning very well until the previous day, but suddenly our liver stops 100% functioning on the next day. So this is called acute liver failure, and as I informed earlier, these things they can be avoided by following a very good lifestyle, having a balanced diet, and taking a proper exercise. Prevention. So you can frequently wash your hands with wash and sanitize your hands, then thoroughly wash your hands after going to the restroom and changing diapers for the kids. Wash the kitchen properly. Kitchen maintenance is very important, so not only for hepatitis transmission, but for other foodborne illness also, kitchen maintenance is very important. Clean the shelves of the refrigerator, clean the vessels properly. Never leave any food item open in the kitchen or in the refrigerator. You can very well get a cling wrap. If you don't have proper lids, get a cling wrap, wrap everything and keep everything always closed. Okay. And to avoid cross contamination in the refrigerator, you can store green leafy vegetables and fruits in a compartment, and there should be always a separate compartment for poultry, fish and meat. Okay, they should not be kept mixed with the veggies and fruits. Apart from this, egg should always be kept in a container, and then closed container should be kept in the fridge. Eggs should not be left open in the refrigerator. It will lead to cross contamination. Okay. Now clean the countertops, clean the cutting boards properly, sanitize them. The vessels and utensils which we use should be also cleaned properly, and the person who is handling all these cleaning things, he should clean and sanitize himself, I mean the hands, after cleaning all these things properly. WHO aims to achieve hepatitis elimination by 2020, and to achieve this, the targets for the countries is reduce new infections of hepatitis B and C by 90%, reduce hepatitis related deaths from liver cirrhosis and cancer by 65%, ensure that at least 90% of people with hepatitis B and C virus are diagnosed, and at least 80% of the people, those who are eligible to receive treatment, they should receive appropriate treatment. Okay, now how can we escape from hepatitis? The main thing is to avoid hepatitis. How can hepatitis be avoided? It can be avoided by checking some certain things. So early diagnosis is very important. So early diagnosis and early treatment can help us in avoiding hepatitis, and being careful can also help us to avoid hepatitis. How can we be careful? We should not share needles, drug needles. People who take drugs, they should not share needles. You should be very careful during blood transfusion, and of course nowadays all the transfused blood or priorly they are checked for hepatitis virus, screened, and then it is done, so it is not an issue. But however, we should be very careful. We should not share the razors, we should not share toothbrush with any infected person. And during sexual life also, any practice of sex which leads to leakage of blood will also from an infected person will also lead to the disease. So by taking proper measures and taking proper hygiene, we can escape from hepatitis B virus. So being a microbiologist, I take it as an immense pleasure to give you an awareness about hepatitis on this day. Thank you everyone. Thank you. Bye.